How many of you remember that old television show, What's My Line? It was great, wasn't it? I loved that show. You had that panel of celebrities, Nipsey Russell, Soupy Sales, and somebody else with a funny name. I think it was Kitty Carlisle. Their task was to figure out the line or the vocation of their guest. We're going to play What's My Line. We're just going to play behavioral health, What's My Line. You're my panel of behavioral health experts. I will be your guest. Your task then, obviously, is to figure out my diagnosis. So I'm going to portray a client to you. What I want you to do is observe and note symptoms. Don't think diagnosis initially. Just think symptoms. When we're done, we'll talk about the symptoms, and then we'll talk about the potential diagnoses. When I use the flip charts, I usually write the symptoms you guys identify up, and then I'll write down the potential diagnoses. I haven't figured out how to do that yet with PowerPoint. So you may want to take your own notes as we process it. But symptoms, then diagnosis. If you want to do an experiment, because Ralph Waldo Emerson's the one who said to us years ago, all of life is an experiment. The more experiments you make, the better. And he was right. When we're completing an emergency evaluation with somebody and doing the emergency work, we are experimenting. We're experimenting to find out about mood and affect, two very different constructs. We'll discuss their differences today. Psychotic symptoms, and we'll break those apart today. Suicidality, homicidality, we'll talk about that and break it down today. Orientation, memory, different things. The experiments that we make obviously take the form of questions we ask clients, collaterals, records we review, labs doctors run for us. Could be as simple as taking a slow, deep breath, inhaling, and see if they smell a little on the funky side. But whatever experiments we make, the more we make, the better. I want multiple data sets coming into me in case one of them is skewed. Okay. So if you want to ask me a question or make a statement to me, throw something out there, knock yourself out. I could have no examiners. I could have 20 examiners. Okay. It's just like every time my son and I go fishing, we cast lines in the water, we figure out where the fish are. Or in my case, we figure out more often where they're not. So symptoms, then diagnosis. If you want to throw something out there, you get some data. You guys ready? Okay, here we go. Nations? Nationwide. Nations? Hallie Nation? Symptoms. You had what, 30 seconds, something like that? What do we see with this guy? What type of hallucinations? So visual hallucinations, right? I always like to describe as evidenced by. Visual hallucinations is evidenced by grabbing at, picking at, touching non-existent objects. What gave you the impression of auditory hallucinations?
It wasn't clear about the things that you were saying, as if you were being spoken to, or
Okay.
responding to something, or hearing.
Okay, so the things that I was saying indicated to you that I was hearing something in my head. Did I hear what you said to me? You said hallucinations, right? Did I hear that? What did I say? What specific words came out of my mouth after you said that? I said nations, nationwide. It's like the song, from the ad. And then he falls out and he comes back up and he says something about nations again. And you had said hallucinations, right? And he said Hallie nations. So he heard what was said, did he not? How would you describe his responses then? Yeah, loose, right? I was going to say, was he logical, clear, and connected? Well, of course not. He was loose. Very much loose. So just by making that statement to him, we were able to generate some data and find out at least that he was loose. So he had visual hallucinations. He was loose. Yeah, he tactile hallucinations, absolutely. I don't look like I have a rash, do I? I hope to God not, or we're going to find an urgent care for me, right? And I wasn't scratching one place like a bug bite. It was scratching all over himself with no apparent physical reason. Well, that would be tactile hallucinations, as evidenced by. So we had visual and tactile. We had loose associations. Describe his behavior for me.
It was fearful or apprehensive.
Okay, fearful, apprehensive. Did he look a little paranoid even when he was backing away? Possibly.
Yeah, but it didn't seem to be anything that caused the
Okay, so something was going on that was frightening him, at least in his head, because there wasn't anything that you could perceive in the environment to cause that. So fearful, possibly paranoid. How else would you describe his behavior? Was it agitated? Okay, okay, very good. We had somebody notice his increase in respiratory rate. Okay, he was agitated. Now, the behavior that I'm exhibiting to you right now, when I'm working with the mouse, or when we're carrying on conversation, that's goal-directed, right? You can see the goal in my behavior. You know the goal when I put my hand on the mouse and I'm moving things around, that type of thing. Was there an obvious goal to this guy's behavior?
No, it's disorganized.
He was disorganized. So he was loose, he was disorganized, he had highly agitated, non-goal-directed behavior, he had an increase in respiratory rate. And what's this deal here with the table? You got a highly agitated guy, right? He's bopping around the room. And then what's he do? He falls out, right? And then what'd he do? Pop back up. Was that a change in, what was that change in that we witnessed? I'm sorry? So a change in alertness? Could you call that level of consciousness?
Did he disassociate for a second?
Maybe dissociated. I don't know. What do you think?
It was a change in his motor.
Okay, so it's motor activity. Okay, so we got this change in behavior, motor activity, level of consciousness. Maybe we call it weirdness. We all got licenses, right? We can make weirdness a clinical term. But we know we had something. We had this waxing and waning level of consciousness, level of alertness, behavior, motor behavior, something. We had an increase in respiratory rate. Now think about this for just a second. You had this patient for 30 to 45 seconds, yet, would you not agree we picked up a tremendous volume of symptoms?